Okay, hello everyone, and welcome to LogRocket's July webinar. Today we are excited to have Antares Meketa join us to discuss how Karuna Health monitors and optimizes their product experience. In addition to Antares, we're also going to have Ben Edelstein, one of the co-founders of LogRocket. So before we begin, I'd just like to let you know that a link of the recorded version of this webinar is going to be emailed to all participants. You can also find a recorded version of this webinar at logrocket.com. At the conclusion of the webinar, we will have a question and answer session with Antares. If you have a question, please add it to the chat or the Q&A section. All questions will be asked in the order that they are received. If you have a question that is not addressed by the end of this webinar, please find us on Twitter at LogRocket or send us an email via the email you received for this webinar, and we'll be happy to get those unanswered questions answered for you. So to everyone who is joining, welcome. And now, before we get to the feature presentation, I'd like to introduce Ben Edelstein, co-founder of LogRocket, to quickly review some features we've recently released here.
Thanks, George. Can you hear me okay?
Can hear you great.
Awesome. So yeah, I'm Ben. I'm one of the co-founders of LogRocket. And for those of you that are not familiar, LogRocket helps teams quickly fix technical issues in their web apps and proactively surface issues affecting their customer experience. And what I'm going to show you today is our new time series insights feature, which helps you understand technical issues and user experience issues that affect the usability and adoption of new features in your application. So let's see, is my screen visible? Cool. So here I have a report I recently built out for a feature that I care about in my application. And this is the reports page. And the way I've defined this feature is when users visit the URL that contains reports and spend more than 30 seconds on the page. And I did 30 seconds because that kind of means like the user meaningfully engaged with this feature. And what you see here is LogRocket showing you over time how many users met that threshold. And often, as product managers, it's, there's a goal to increase adoption of a new feature. So you'd want to see this graph go up and to the right. And within LogRocket, there's a couple ways to think about driving better feature engagement. And the first is by getting qualitative feedback on how users are interacting with the feature. So down here is a list of users who have recently used the feature. These are their sessions. And I can go ahead and click play and actually watch real users interacting with this feature. And this is a great way to build empathy for users. And it's always very illuminating between going from designing a feature to actually seeing real users interacting with it. There's always things that you don't expect. I always notice like UX issues or small bugs. And so it's really helpful to just watch a bunch of real users actually interacting with the feature. But when you have hundreds or thousands or millions of users using your product, just by watching a couple of user sessions, you're leaving a lot of potential insights on the table. And that's where LogRocket's insights come in. And what this is it's LogRocket using data science across all the data we're collecting. So every single user session in your application, every event and both technical and user events in every session. And we apply data science to find issues that have a statistically significant impact on, in this case, on adoption of this feature. So each of these issues, LogRocket is showing you how many users did this issue cause to bounce and stop using the feature before that 30-second interval. And these are things like UX problems, like dead clicks or rage clicks, and then technical signals like network issues or JavaScript exceptions or slow performance. And for any of these issues, I can see how many users did it affect, and then I can, of course, click into it and actually watch real user sessions and see what does it look like to a user when this issue happens, so that I can get a sense for like just how bad is it from a user perspective. And of course, with LogRocket's developer view, I have all of the technical telemetry from network logs to errors to console logs and details about the user's session, so that if I then go and send this report over to the engineering team, they'll have a very easy way to reproduce and fix the issue. And we built LogRocket Insights because customers often come to us, and one of the problems they note is that as product teams, it can be hard to prioritize fixing issues versus building new features. And with LogRocket's Insights, last month I talked about funnel insights, which show you meaningful ways to improve conversion rates by fixing bugs. And today this is meaningful ways to improve feature adoption by fixing bugs. It makes it much easier to prioritize which of these bugs is most impactful to fix. So this is just one of a bunch of ways LogRocket can help you improve your product experience. And if you'd like to learn more, visit us at logrocket.com or just reply to the webinar email you received, and we'll be happy to schedule some time to show you a more in-depth demo. But now really excited to turn things over to Antares Meketa, who is the Chief Product Officer at Karuna Health. And he has a fantastic presentation prepared on how to optimize product experience.
Cool, yeah, happy to do that. I can share my screen here in a second. I think, Ben, you might have to stop sharing yours first. All right, perfect. Let me see. All right, everything working properly? Excellent, okay, cool. So yeah, it was interesting to see there's new features, even new to me, using it. So I'm looking forward to starting to poke around at that, which we will do. So my name is Antares Meketa, and as Ben said, I'm the Chief Product Officer at Karuna Health. What that means for us is that I'm overseeing both the product and engineering functions of the organization. My own background is in software development and product management. I've been doing that since about 2003, and I've been working in health tech specifically since 2010. And what gets me excited about working in this space in general, and what I'm going to be talking about a lot today, is the opportunity to develop consumer quality software in an industry that historically really has not had that level of sort of user experience and customer experience quality. But first, I want to introduce Karuna Health. Our core mission at Karuna is to improve healthcare by making it really easy for patients and their care teams to stay in touch with each other. This is something that we refer to as bidirectional patient access. We've deployed our solution with different kinds of groups in the health space, but really primarily we're finding traction in what's referred to as care management. For anyone who's not familiar with care management, the easiest way of sort of understanding what that is it's basically how you provide care for patients in between traditional points of care. So a common example would be someone who has some sort of underlying undiagnosed health condition, like diabetes, let's say, that they haven't actually diagnosed yet. Something will happen, some emergent problem will happen, and they'll end up going to an emergency department, usually to sort of say like, hey, there's something wrong with me. I don't know what's going on. A doctor will see them and will probably treat the emergent condition, but they can't actually solve the underlying problem in the emergency department, right? So what's going to happen in that case is that the person will be discharged from the emergency room, and they'll be given a set of follow-up instructions of things that need to happen, right? They may need to go and fill a prescription. They'll probably need to schedule an appointment with a specialist within a couple of weeks to kind of talk specifically about managing their diabetes and what they can do to sort of improve it over time and manage that condition over time. Now, they get all of these things in discharge instructions, and without care management, they're essentially left on their own, which is really, really tough for a lot of people, especially if you're coming from more of like an underprivileged background. You might not have access to even sort of simple things or things that we take for granted, like the ability to get transportation to even see a specialist, even if you can like figure out whom to call and how to book an appointment. So there's a lot of risk there at that moment when someone is discharged, where they could fall through the cracks. And if they fall through the cracks, or if they don't end up, filling that prescription or making those appointments, they'll end up probably coming back to the emergency department, which can be very expensive and very difficult, and ultimately result in like much worse outcomes for that patient. So care management solves this by proactively reaching out to patients like this and helping them get access to different kinds of social services and resources that they might need so that they can do all of these follow-ups that they need to do. And what we do at Karuna is we help care managers do that work really efficiently, making it as easy as possible for them to reach out to their patients and let them know that they're available. And then also for those patients to reach back out to their care team to ask questions or get access to these kinds of resources, which reduces a lot of the sort of costly follow-up visits that might happen to emergency departments. So how do we do that? What does the product look like that we're bringing to market? From the patient's perspective, it's important to know that they really don't know that Karuna exists, right? So from their perspective, they can just call or exchange text messages or MMS messages with their care team, and everything just works. It's important there to note that what we're not requiring is that the patients have internet access or that they have smartphones, right? They don't need to download an app in order to actually communicate with their care team, which can be a huge barrier to entry, especially again with more sort of underprivileged or traditionally disenfranchised groups who might not have easy access to those things. So that's what it looks like from the patient's perspective. From the care team's perspective, there's a lot more going on. So they're the ones who are actually logging into Karuna, into our client app. They can see their patient caseload. They have a shared inbox with a single view of all of the communications back and forth between them, like different staff members and the patient. They can get things like automatic call recording and transcription, translation services, and more. We also try and help them improve their workflows by doing things like giving them the ability to send templated messages and adding sort of light layers of automation to some common tasks. So if you need to reach out to everybody who's on your caseload to just remind them that you exist and that they can reach out to you for questions, those are the kinds of things that we can help them automate. From a technology perspective, for anyone who's interested in that, we do have, like most sort of common, modern web apps, we have a pretty strong separation between the front end and the back end. Our back end has a single API layer that is sort of sitting between a bunch of Ruby on Rails microservices and any clients. And then the front end clients that we have that we've deployed so far are using React and React Native for mobile apps. And then it's also important for us to just sort of acknowledge, like, we are a very small team. We're a seed funded startup. We have 8 people total at the company and 3 full-time software engineers, including myself, like anyone writing code. So this leads us to, what our general challenge is in this space, right? Which is, how can we be a small team that's developing an excellent product in a startup world? We are like most product-driven startups. We want all of the things that are on the right side of this slide, right? We want rapid iterations. We want to use a great technology stack. We want to do more with less. We want to create an intuitive product that's really simple and easy for people to use. But in this space, we have this huge barrier of data privacy and HIPAA compliance and regulation that are just absolutely non-negotiable parts of what we do. Basically, anything that we do, any code that we write, any feature that we introduce, any group that we want to partner with has to take security, data privacy, and HIPAA compliance extremely seriously. It has to be sort of the first part of the conversation that we have anytime we do anything with our product. And that has a huge potential to weigh us down and prevent us from accessing a lot of the stuff that we want to do on the right and kind of the way that we want to operate as a software team and as a product-focused company. So how do we solve this? It won't surprise you, given this webinar that we're having with LogRocket, right, to know that LogRocket really is a critical piece of the puzzle for us in terms of allowing us to do this and giving us tools that really help us get that level of sort of product sophistication without compromising our ability to be HIPAA compliant and maintain sort of strict data privacy and patient privacy requirements that we have as a company. But I want to talk for a second just about why this actually matters so much for us. And there's this myth in healthcare that anyone who has sort of done software in healthcare has probably heard before, which is that user experience doesn't matter. And that's kind of an understandable conclusion that you might draw if you are familiar with a lot of software that's sold in healthcare contexts. If you're not familiar, by the way, I would highly recommend opening a new tab and really quickly just Google Epic EMR, which is like one of the most popular EMR software solutions that's sold, and just look at the screenshots and sort of judge for yourself, how much UX was taken into consideration when they were developing that software. Obviously, right, like for huge entrenched players like Epic and Cerner and things like that, this is less of a concern for them because they're solving other kinds of problems. And they also have a huge install base, and they are doing, integrations with every possible software solution under the sun that their customers might need. And so they're solving these real problems, but they don't have to focus so much on UX. And that's fine for them. With that level of popularity, there are probably teams of people who aren't even employed by Epic who are like certified Epic EMR trainers who can help new, hospitals and things like that train their staff on how to use that software, right, for a fee. There's probably a whole industry that's built around that. But what happens when you're a tiny startup like we are, like Karuna is, right? How do you break into this space and actually bring something that's innovative to market? What we've done, and traditionally, I think what a lot of other sort of more successful, smaller health startups has done, is really start small, right? You want to find smaller companies who need what you have and who are looking to innovate and looking to take a risk. And you can do that. There's like a whole sort of sales strategy there in terms of how you sort of start to, bring your product to market. But you also really need to win your customers over after they start using your software. Unlike Epic, there's never going to be a Karuna certified trainer or, industry around helping people understand our product. Like the product just has to work, and it has to be intuitive and understandable on its own. So we think about it, about this general problem in these three categories around increasing user adoption, iterating on and optimizing the product for our customers, and then all in all, providing an ideal customer experience. The first step of this is really focusing on our new user experience. So what does it take for someone who's not familiar with our software, a care manager, to get signed up, to get onboarded, and actually start communicating with their patients, right? How can we minimize the amount of training and help that's actually required to help them do that? When we started the company, when we first sort of signed up our first few customers, we were doing the unscalable thing of going and doing one-on-one trainings with everybody. So literally everybody who used Karuna would have one-on-one trainings with one of our staff to help them map out their workflows and sort of show them how they can use Karuna to improve things. We've learned a lot doing that, and we've baked a lot of that into our product. We are already at a scale with, basically about a dozen customers. We're already at a scale where it would be completely unsustainable for us to keep doing that strategy. So what we've done is we've had the product solve this, right? And what we can do now when we onboard new customers is we can more passively sample by looking at LogRocket sessions for users who are onboarding, and pay really close attention and say, okay, is there anything here that seems like they're not quite getting it? Is there anything that seems like it might be a sticking point for them, for their workflow that requires more digging? And then we can dig in there. So it's already helped us dramatically improve the amount of training that we actually need to do for new users as they onboard. And then anyone who's sort of never done live user testing or never seen session recordings might not appreciate this, but like Ben was mentioning earlier, there's so much stuff that you can learn by just watching people use your product. There's a bunch of assumptions that you've probably made that aren't playing out in terms of how people think about the features that you're building and how they use it. And like all of us sort of know who are, sort of like more product-oriented folks, there's so much work, right, that needs to go into making something feel simple and intuitive and really improving workflow. And there's a lot of really common behaviors that you'll see if you don't have it quite right yet. So rage clicking is one of my favorite terms in this industry, is something that, that we see and that LogRocket actually sort of proactively tracks for us, which is really cool. But also just sort of hesitation, like if someone isn't sure what something's going to do, or if they can't find something, they'll just sort of endlessly scroll up and down trying to find it. So these are things that we can use LogRocket to actually sort of proactively identify and not just wait until someone tells us like, hey, this button is actually really hard to find, or I was concerned when I saw this form or modal because I wasn't sure what was going to happen when I hit submit, right? Those are the kinds of things you would never actually get explicit feedback on, but you can sort of understand by looking at session recordings. And of course, all of this has to happen, right? This is great. And watching session recordings can be a UX improvement and user adoption goldmine for us. But we need to be able to do this in a way that's not compromising patient privacy in any way. And that's a really difficult problem to solve. There's no way for us to use any other session recording software and do something like, like opt into what data is shown. Like pretty much everything that happens within our product, given that it's like sensitive patient communications, every part of the screen, right? Every part of every page is potentially PHI, it's potentially extremely sensitive information. So we can't take a sort of like opt-in or opt-out approach to this. We really need to have the ability to have everything fully secure from end to end. And sort of controlled by us, which LogRocket has allowed us to do. The second sort of conceptual gap here that LogRocket helps us fill is understanding how the iterations that we are making in the product are helping our customers. So we'll develop new features like any other product team with an informed hypothesis, and we'll do some research, design research, ask our customers questions, and try and sort of synthesize that into our best bet as to what we can do to help them. But we still need to answer questions after we deploy this, like, are people actually using the feature that we just released? Do they understand that it exists? Is it discoverable enough? And more importantly, are they using it the way that we intended? There will always be things along the design process where you think, oh, this might be a problem, but it might just be an edge case, right? And the question is it actually an edge case, or is it something where you deploy it and it's certainly like everybody is hitting that edge case and it becomes the main way that people interact with the feature? Is this problem that you thought might not be a problem? So these are all sort of questions that we'll have for any iteration that we do. And we'll want to use LogRocket to actually help us validate some of those things. It's actually really funny because even literally just this morning, last night, we deployed a new feature for a customer that was going to help build a pretty customized workflow for them. And we did this last night after hours for them. And the first thing that I did this morning was I logged into LogRocket to try and pull up the people who were going to actually see this new feature and see how they were using it. And I found out that a couple of things. One is that it was working the way we intended, which is great. But we did find that there were a couple of people specifically who just did not understand that there had been a change made and they were still sort of using this old workflow. What that enables me to do is then talk to our customer success person who can then reach out to those people and say, hey, as a reminder, right, we just did this thing for you and it actually works pretty well, but like, here's how to use it. And we can just be super proactive about managing those experiences. And otherwise, we may not really have gotten that kind of insight, and certainly not that quickly, into whether it was working or not. So all of this together, right, the increasing user adoption, being able to understand intuitively whether something is making sense or not, and whether the iterations that we're doing are helping, is all kind of under the umbrella of providing the ideal customer experience. Our users in this space are not usually the most technically sophisticated population. And there can be a real serious communication gap when we try and help them troubleshoot something. Having something like LogRocket in place immediately becomes a central part of what we do in our own internal processes for troubleshooting issues that customers are bringing to our attention. So at the very first sign of confusion or like a lack of clarity, if we don't understand what someone is saying, we can just look up their session and help understand them. So a literal typical inbound support request we get, because we do phone calls and text messages and these kinds of things, will be people will say calls aren't working. And that's it. They'll like submit a support request that just says calls aren't working. And what are our options here? Like without LogRocket in place, we would probably have to do one of two things. One would be go back to them and ask them specific questions. Like, can you explain what you mean by calls aren't working? Like what calls aren't working? Are inbound calls not working or outbound calls not working? That would be one option. Another option would be to escalate the issue immediately to an engineer who can go look through more detailed logs, right? or to build like complicated admin interfaces to expose some of that information to our our less technical support staff. But with LogRocket, what we're able to do is be basically like mind readers. Like we can just say, oh, okay, you're saying calls aren't working. We're just going to go immediately to the last few sessions that we have recorded so that we can see exactly what you mean by this. Like, what did you attempt to do in our product? How did that actually get surfaced to you? What errors did you see? What's the source of those errors that might be causing this? And then we can communicate back to something as simple as calls aren't working with something really sophisticated, which is like, oh, it looks like for these patients, you're trying to call a number that doesn't actually exist. This is how you know that that happens in the product, and et cetera, et cetera. So this is really, really critical, like I mentioned before, to being able to provide this level of customer experience that we want to provide. And that's being able to do that is really important for us as a business, right? Like this is what allows us to really get our foot in the door and drive ground up adoption of our software within these groups. We want to become an essential part of our customers' work. And this is what helps us do that. And this is usually very hard to do without the kinds of tools like LogRocket to understand and sort of help us improve our product over time. And then one last thing that I just want to call out quickly is, as a software developer myself, I'm always amazed when I think about how little code we're actually writing, right? If you think about just the number of libraries and underlying frameworks that we use every day, the actual code that we're writing or that Karuna is writing is probably some minuscule fraction, right, of all of the lines of code that are going into delivering the solution that we are delivering to our customers. And similarly, integration points like these ones, like LogRocket or Sentry or Sumo Logic or Telnix, right? These play exactly the same role in our business. They help solve specific complicated problems really well so that we don't have to throw more and more people at solving these problems. We can just leverage what other people are doing and help innovate by tying all of this together and doing new things with sort of the holistic set of solutions that we're bringing to market. So I think this is something that a lot of people take for granted these days as just an option available to them. But it's really particularly hard for us and for any company that's in more of a highly regulated space to adopt this kind of strategy and to pick these kinds of partners, because there are so many partners who don't really understand data privacy issues. They don't understand compliance or regulation issues. And that means that they're immediately off the table to us. So it is such a huge part of what we do is, sort of vetting these kinds of partners. And I am really, really happy that we've been able to get an on-prem installation option, right, for LogRocket, because it helps us actually do what we want to do, and in a way that we can feel very confident and sort of secure in our partnership here. So this has been a bit of a marathon, a lot of different stuff to walk through around sort of what Karuna does, what care management is, the importance of user and customer experience in this space, and how we use LogRocket to sort of help us achieve that. I think the main takeaway I'm hoping to sort of leave you all with is that it is possible to do all of these things. It is possible to be small and nimble and provide really great experience with very few people. If you can find the right kinds of partners, you can still do this, and you can really make a tremendous amount of difference in the healthcare space with limited resources. And that's what we are trying to do.
That was great. So so now we're gonna open this up to some Q&A. So if anybody has any questions, feel free to add them to the Q&A section or to the chat, and I'm more than happy to relay them. So to get things started, I mean, we've talked about this, but given that we're in the world of COVID-19, how has that impacted Karuna? Both if there are positive aspects of it, if there are negative aspects of it, just what is kind of your life like as a health tech startup now in this new world?
Yeah, it's really interesting and sort of somewhat hard to predict. I mean, obviously it's a really terrible thing that we're kind of all going through right now in different ways. And certainly it's affecting a lot of different kinds of businesses in different ways. Purely from the perspective of, has it been sort of good or bad for business for us? I think it's been a mix of both. on the one hand, certainly everybody is recognizing that remote patient access, like being able to stay in touch with patients outside of traditional points of care, is increasingly important. There's been a lot of regulatory changes that have also happened since the pandemic started that have also been very interesting. And I think there's a way in which, remote patient visits and these kinds of things are changes that are happening in the healthcare system as a whole that aren't going to go away, like even after we get this particular, outbreak under control. We can play certainly a huge role in that, right? Like part of the whole thesis of what we are building is the ability to, improve bidirectional patient access. So getting patients the ability to remotely ask their care team questions and vice versa, allowing healthcare professionals to reach out to patients and manage populations of patients over time. So in that sense, we've gotten lots and lots of renewed interest from different kinds of groups, and we've had lots of inbound requests, and we've been talking to a lot of different people about rolling us out in different contexts, which has been really great. It's also just been chaotic, just to be perfectly blunt, right? People are really trying to scramble to figure out how this affects them, right? The kinds of groups that we sell into and our customers, the people we serve, are all being impacted themselves in really different ways. So, we used to work with people who did a lot of in the field work, right? Like care managers who would literally go to door, and they, for them, one of the biggest things for them was our mobile app and sort of iterations that we were doing there so that they could do all of this stuff and stay in touch with patients while they were on the road. That has changed. So the priorities are certainly shifting for some of our existing customers. And similarly, when we go to new customers and we say, let us come in and sort of help you with this, they're interested in doing that, but it's also very complicated. I think everybody is sort of struggling with, what decisions do we want to make here? What new solutions do we want to bring in to do the work that we do? So yeah, it's been very interesting, and I'm really encouraged for sort of how this looks in the future, but also a very chaotic time.
So there's a follow-up in the chat that says, how have you dealt with the overall bandwidth or overall need regarding virtual visits, virtual client follow-ups, I guess, given the world that we're currently in?
Yeah, I mean, I would say it's something that, we've been doing from the beginning. I think, again, there is a lot of renewed interest from different customers that we're talking to in adopting our solution and sort of putting it in place. Sometimes it looks a little bit different than what we've been more traditionally doing. So Karuna is really more of a platform for patient communication. And when we go into smaller care management agencies, we essentially just become the way that they communicate with patients, full stop. What we're seeing now is that there are larger organizations who are interested in some of the things that we're doing, specifically around helping kind of add lightweight automation to communications and sort of helping reduce the burden on their staff of communicating with patients, because the need for remote communication is going up so much. So we're seeing that, which is interesting. But then it's also when we go to those groups, right, we are very unlikely to be the only way that they communicate with patients. So one of the pressures that it's putting on us is more in terms of, what systems can we integrate with them to, sort of help build out more complex workflows where we're playing a piece of this larger ecosystem.
Excellent. Another question I have, just given what you were discussing earlier, are there, any examples that you can think of where there's something you learned about user behavior, either through LogRocket or just through, a different member of Karuna Health, and kind of how did you go about discovering that sort of user behavior change and then prioritizing how that got into the product itself? Can you just give us an example of when that occurred?
Yeah, sure. So one of the slides that I had earlier, actually, in this, I can pull it up, shows one of these features that we rolled out, which is templated messages, right? So this is something where, when we talk to our customers, we found that a lot of them need to send similar kinds of messages to patients over time, right? And not necessarily like this example of sort of an out of office notification is a good example of something that can be like pretty much fully automated and sort of sent out to a lot of members at once. But also just even in day-to-day interactions, right? Like the first message that you send to a member should probably, you know, follow a template or could be templated, these kinds of things. So this is something where, you know, again, the initial hypothesis is based on conversations we have with customers, really understanding their needs and understanding, you know, where some of these similarities might be. Our first iteration of this was basically to try and make it as simple as possible, pre-fill as much information as possible. And as soon as you were done, you just hit send and it just sent the message to the patient. And what we did there was we ended up actually discovering that there were some subtle and complicated issues with some of our hypotheses around whether this would be like a feature that people would use. So we would see people start to do this and then they would kind of like fill out the template and then end up basically like pausing before hitting send and say, no, actually I'm gonna hit back. And then they would type out a custom message to the patient instead of using the template. And that really keyed us into sort of a deeper truth here, which is that when people are communicating with patients, especially ones that they know really well, templates are a really great way to get started with a message and to like save them time, like trying to draft the same thing over and over again. But everybody wants to customize it. Like everybody wants to customize the parts of the template that you can't customize normally, right? So, you know, people will want to put like emojis in, or they'll want to put like exclamation points and like sort of bring it into the tone of, you know, their voice essentially. And that was like a really important insight that I think we probably didn't give enough weight to when we were originally designing the feature. And one of the things that we changed based on that, and sort of based on the learning there, was rather than have it just send out automatically, we changed that call to action to insert. And what that does is it then inserts it into sort of the composition window as the full rendered text. And you can hit send if you want, or you can make any changes you want before hitting send. It's stuff like that, I think, that we were able to do and sort of prioritize based on how often is this happening, you know, how much of a benefit do we think is still there with templating, which it really is, especially with mobile devices in particular, where it's like hard to type out lots and lots of more like complicated appointment instructions, things like that. But yeah, I would say all of that and the feedback that we got sort of went into the prioritization process of, you know, how do we fix this and how can we actually resolve this? And, you know, I'm happy to say that like after we did that, it's very, very different now in terms of how people are actually interacting with the feature, and people are a lot more comfortable and sort of making tweaks as they go.
That's great. Right. So another question, has LogRocket been used to help ensure data privacy in any way?
Yeah, I mean, absolutely. Like it's sort of, I mean, I would say it's been used, like we've been able to use LogRocket because of the commitment to data privacy from the get-go. So there's a pretty, I don't know if anybody sort of is aware of this, but there's a pretty full-featured way of doing an on-prem installation of LogRocket, which is a hard problem to solve, right? If you're doing software as a service in particular, where kind of like licensing and authentication, I understand, is still, you know, done through your main servers, but then like we are actually able to run our own copy of LogRocket in our own instances and our own VPCs, and sort of with the different kinds of like access constraints and logging and all of that to make it, you know, bring it in line with the rest of our software solution. So we have that, and that's really like really, really critical, just because, like I said before, you know, there's other options that that are offered. So I know that like, for example, like Sentry, which does error reporting, you can either go down the road of signing a BAA with them, which is like a legal document that's required as part of HIPAA compliance with subcontractors. It's probably not worth getting into all the details there, but you can go down the road of doing that, or you can try and sort of like proactively mask data that you send to Sentry. And the masking data thing is just such a terrifying concept, right? Because it's like the one time that you forget to mask something really critical, the one time you realize that, oh, that patient's phone number was actually in the title of an error message we sent and we forgot to mask it, is the time where you have essentially like exposed data in places you should not have exposed. And that's like technically a HIPAA breach, potentially, right? So that's something that when we assess different options, it's like one of the first things that we look at is, does implementing the solution mean that we're going to have to think every time we do anything about whether we're exposing PHI someplace that we shouldn't be? Or is this something where we can safely incorporate this into our environment and, you know, apply the same levels of data privacy and sort of regulatory compliance to this solution that we do to all of the stuff that we build in-house? And that's most important to us because we, you know, we want to, like, doing real security first software development means not leaving it up to chance every time, right? That you just remember to implement something correctly or, you know, pass the right data between different services. Yeah, so I think it's been something that has been, it's allowed us to do really like deep dives into how are people actually using our product and actually interacting with sensitive patient data, and allows us to access that as we need to in order to improve the product, but still limiting, right, who all has access to that information.
Excellent. So we have another question that says, when evaluating user issues, how do you decide if you address it with the customer success team first versus reevaluating the product design entirely?
Yeah, that's a really good question. I wish, you know, as a product person, I wish that there was like one simple answer, right? It's like cost of delay over complexity or whatever, like the formula for how you prioritize things. Yeah, I really wish that there was one easy way of doing it. I think what we end up doing, you know, is some amount of internal assessment of what's going on, right? So there's usually a, you know, and I'll say like there's like a discovery phase, but what I'm talking about is literally probably like, you know, a really quick kind of meeting together to talk through what's the issue that, you know, is being reported to us, what's the root cause of it, is this something that seems like it's impacting, you know, everybody, or sort of like what portion of our customers or customer users are impacted. And then depending on, you know, what we're talking about, like, are there really easy workarounds that we can do? Again, as a small team, if there is something where customer success can reach out and just, you know, help people know. So for example, the thing that I mentioned that happened this morning where someone was just kind of unaware of what was going on and like that we had developed this new feature and launched it and they were still using this old thing. That's something where, you know, one conversation can really quickly solve it. And then we can kind of move on from there versus something like the templates where if you do want to make that change, right, and you do want to put something in your own voice, unless we made a product change, there would be no way for them to do that. Like they would be literally, it would be impossible for them to use the feature and still achieve the goal that they're trying to achieve. So I think it's on a case-by-case basis, I would say, based on those things. And what we try and really ask ourselves is, you know, is the issue that we're seeing something that feels like it is undermining one of our core assumptions about what the goals were when we built this feature? And if it is, then it's probably worth unpacking a little bit more to try and discover like, oh, what was the goal that we didn't account for here? And what would that imply about what we would need to change in the product? But always in the interim, if there's something where we can have a customer success person reach out and help them solve the problem within minutes, right? Then that's always something we're going to try and reach for.
Excellent. All right, so I think we have two more questions. So first, how did you go about learning more about what it takes to build HIPAA compliant software? Are there any resources that you would recommend that you feel are particularly easy to understand?
Yeah, that's a really good question. And it's something that ultimately I like. The honest answer is that it's something that I learned on the job. I feel like I've had, you know, like some tiny fraction of like a law degree and just like having to dig through a bunch of these things and talk to people who know more about this than I do and sort of help understand the general frameworks involved to help make decisions. The HIPAA guidelines are pretty readable, honestly, but they're also pretty vague. It's the kind of thing where if you actually read the regulatory text, it's basically a set of like best practices and some specific restrictions on things like, oh, data needs to be encrypted, you know, in transit and at rest, and these kinds of things, right? But what you end up actually doing on sort of a case-by-case basis is a little more complicated, and it's I don't have anything like off the top of my head that's like a good overview of sort of how to approach those problems. I would say it's important to familiarize yourself with what the actual law says. I think anyone who's doing business in this space really should be reading that law, like, and trying to understand it as best they can, just from the raw text itself. And then it's probably also good to just have conversations and like talk about this stuff openly with your own team and with other people, especially as you're starting to embark on something that could potentially have data privacy concerns, right? If the way I sort of have ended up thinking about this in shorthand is really understanding, where does the data live, right? Like there's some things that you can do to protect and make sure that the stuff that you're building is built to be HIPAA compliant from the ground up. But then the things that you end up having to be mostly concerned about is what data is flowing into other systems, and how can you sort of prove out a chain of trust, essentially, between all of those different partners who might have access to this data. And sometimes in the case of LogRocket, the chain of trust is that we don't have to trust LogRocket, right? Like we don't have a BAA in place with LogRocket because we don't give them any data. Like they never have access to the data that we're capturing on any of these things. And that's one possible solution. Another common solution, like I referred to earlier, is a business associate agreement or a BAA. And that's essentially how HIPAA works, right? Like HIPAA is not saying that patient data can't be, transmitted between, two different entities without the patient knowing. What it's saying is, if you're going to do that, then you have to have in place legal agreements that bind everybody in that whole system into the same set of common acknowledgements about both like how to protect the data that they're dealing with, and also importantly, how to report any issues back up the chain. That's another sort of critical part of that. I should probably say, like I know I said before that I got some fraction of like a JD, but I'm definitely not a lawyer. And it's worth, looking at different kinds of like HIPAA training programs, which again, if you are working with PHI, if you're working in a HIPAA context, it's part of that is that you're going to want to do trainings for all of your staff who have access to this and help them understand. I guess one thing that we do use is Aptable for our infrastructure hosting, our platform as a service. And they also have another product. I think they changed the branding of it recently, but I think it's like Aptable Comply, which is like a set of videos for like video training and learning tools for, what is HIPAA, what does HIPAA compliance mean, and specifically what does it mean for developer teams? Like how do you think about risk and HIPAA compliance within a software development organization? And that's been helpful for us.
Great. All right, final question. Implementing the conversational API in offline mode. Is there an idea to automate responses based on previous data, or is that something that doesn't comply with health regulations?
That's really interesting. There's kind of a lot to unpack there. So what we have done is we've been able to separately sort of store encrypted data on different devices. And this is really for the care managers, because again, for patients, they're just using the normal like phone calls and text messaging applications. It's also worth noting here that anyone who has worked under HIPAA compliant environments may be like sort of thinking to themselves, how are we doing text messaging at all? Because text messaging is not a secure channel, which it isn't. What we need to do is actually get patient consent to use texting to interact with their care managers explicitly. So that's part of our process for doing that. But there are definitely similar kinds of concerns that, that the question asker is raising around how do we make sure that things like mobile devices that are using our app are, again, sort of encrypting data locally and in transit. And also, like the automated messages are mostly coming from the backend, so that wouldn't be something that would be more of a concern for cases where you're offline. But all of the data that we persist on the device, right, whether you don't have an internet connection or you do, needs to be treated like carefully and encrypted separately, which we are doing in our mobile app. So all of that information like on each device is encrypted. There's also other things that we do to try and specifically avoid leaking information to other phone apps or other parts of the system that might end up essentially like sort of like leaking that to like Apple or Google, right? Or something like that, like backing up contacts. So one of the things that we do is we actually mask the incoming number. So if a patient calls to try and speak with one of their care team members, we'll route the call to the right person, but we'll actually mask the number of the originating call so that they don't end up accidentally like storing that person's phone number on their phone and backing it up to Apple and those kinds of things. So there's a lot of pretty complicated things that you have to think through in those contexts to ensure that, which is definitely a good question. It's something that we've really had to dig into and understand and be very thoughtful about, like what is the essential, like the app ecosystem look like on Android and Apple, and where are the areas where we could inadvertently like start to leak that kind of information, right? So push notifications, incoming calls being like logged in uncompliant ways and those kinds of things.
All right. Well, that's great. So we're at time. So Antares, thank you so much for taking time out of your week to come speak with all of us. To everybody here, thank you for attending. You will be receiving a recorded version of this webinar shortly, and we hope to see everyone again. So thanks again.
Great. All right.